Quick revision of reproductive health. According to WHO, total well-being in all the aspects of reproduction, that is physical, emotional, behavior and social, is known as reproductive health. Reproductive health problems and strategies. India was the first countries in the world to initiate action plans and family planning program in 1951. Next, major tasks under RCH program. First is introduction of the sex education in the school. Second is creating awareness through radio, visual, print media. Next, creating awareness for the problems like uncontrolled population, sex abuse, sex-related crimes. Next is educating people for birth control options, care of pregnant mothers, postnatal care, importance of breastfeeding, equal opportunities for male and female child. It's providing information about reproductive organs, adolescents, safe and hygienic sexual practice, STDs, AIDS. Next, population stabilization and birth control. In year 1900, 2 billion was the world population size. In year 2000, 6 billion. In year 2011, 7.2 billion world population. At the time of independence, 350 million was Indian population. Then in year 2000, it became 1 billion. In year 2011, it was 1.2 billion. In May 2011, it was 1.2 billion. According to 2011 census report, population growth rate was less than 2%, that is 20 per thousand per year. Reason for increase in population: decline in death rate, decline in maternal mortality rate, decline in infant mortality rate, increase in the number of people in reproducible age. Using print media to display the advertisement the steps to overcome the population growth rate. First is use of print media to display the advertisement, example hum do hamare do, motivating the smaller families for contraceptive methods. Next, in incentives to smaller families, statutory raising of marriageable age of females to 18 years and male to 21 years. Next, young and urban couples adopting world child norm. Next, contraceptive methods, the method which are help to prevent the unwanted pregnancies. Ideal contraceptive features: user friendly, easily available, effective, reversible with no or least side effects, and should not interfere with the sexual drive or desire of the user. Next, contraceptive methods: natural or traditional and artificial method. Natural or traditional method includes periodic abstinence, coitus interruptus, lactational amenorrhea. So first is periodic abstinence. Couple avoids coitus from day 10 to day 17 of the menstrual cycle. It is periodic abstinence. Coitus interruptus, male partner withdraws his penis from the vagina just before ejaculation so as to avoid insemination. Next, lactational amenorrhea, maximum 6 months period. Menstrual cycle does not occur during the period of intense lactation following parturition. Artificial method has barrier method, IUDs, oral contraceptives, injectables, implants, surgical method. Artificial method. First is the barrier method. Ovum and sperms are prevented from physical mating. Prevented from physical mating in barrier method. It includes condoms, diaphragms, cervical caps, vaults, and condoms are disposable, gives privacy to the user, and protect the user from STDs, sexually transmitted diseases. And condoms are of two types: male condom and female condom. Male condom covers the penis, Female condom covers the vagina and cervix, and male condom diagram is given here, and female condom also. So next thing we have is diaphragm, cervical caps and vaults inserted into the female reproductive tract to cover the cervix during coitus, prevents conception by blocking the entry of sperm through the cervix. Blocking the entry of sperm through the cervix. Okay. Next, spermicidal creams, jellies, and foams are used along with this barrier to increase the contraceptive efficiency. Next, second one artificial method is IUDs, intrauterine device. First is the non-medicated IUD, which is Lippes loop. Next is copper releasing IUD, which is copper T, copper 7 multi-load 375. Copper ions released from 375. These IUDs suppress the sperm motility and fertilizing capacity of the sperm. Hormonal IUDs, example progestasert, LNG20. So this makes the uterus unsuitable for implantation and cervix hostile to the sperms. Next we have oral contraceptive pills and tablets. So it has first is Saheli, which is a non-steroidal pill. It prevents implantation and have few side effects and high contraception values. And the second one is progesterone or progesterone and estrogen combination, which are steroidal pills. Mode of action: they inhibit ovulation and implantation. They alter the cervical mucus. Pills have to be daily taken for a period of 21 days, starting preferably within the first 5 days of the menstrual cycle. Right. Next, so pills have to be taken for 21 days, starting from the first 5 days of the menstrual cycle with a gap of 7 days. Next, implants and injections. They prevent ovulation and implantation and are placed under the skin, and they contains progesterone or progesterone estrogen combination. They alter the cervical mucus. And next we have emergency contraceptives. The mode of they are made of progesterone or progesterone estrogen combination. They are effective within 72 hours of the coitus, and they are used to prevent the possible pregnancy due to rape or uncasual or rape or casual unprotected intercourse. Next, so IUDs are used in case of emergencies, and surgical or sterilization method, terminal method to stay to prevent any more pregnancy. It blocks the gamete transport, and these methods are highly effective, but reversibility is poor. And there are two types: vasectomy and tubectomy. In vasectomy, vas difference is cut and tied. Vas difference is tied and cut. And tubectomy, in female, fallopian tubes are tied and cut. So in vasectomy, small part of vas difference is removed and tied up through an incision on the scrotum. In tubectomy, small part of fallopian tube is removed or tied up through a small incision in the abdomen or through abdomen or vagina, and here it was scrotum. Next, MTP or induced abortion, intentional or voluntary termination of pregnancy before full term. It was legalized in India in 1971, and MTPs of first trimester are safer and second trimester are riskier. Next, MTP is performed first to get rid of the unwanted pregnancies. Second, failure of contraceptive during coitus. Next, if continuation of pregnancy could harm could be harmful or even fatal to the mother or fetus both, and either due to the casual unprotected intercourse, or there is substantial risk that if child were born it will suffer from physical or mental abnormalities. MTP Act 2017 intentions was first reducing the incidence of illegal abortion. Second was reducing the consequent maternal mortality or and morbidity. So MTP may be done in the first 12 weeks, in more than 12 weeks, and less than 24 weeks. So in the first 12 weeks by permission of one medicinal practitioner, and if more than 12 weeks, then two medical practitioners. Next, STIs, also known as venereal diseases (VD) or reproductive tract infections. So name of the STD, gonorrhea. Pathogen is given. No, no need to remember the pathogen name. Just remember whether it is a bacteria or virus and this thing. So gonorrhea is caused by bacterium. Herpes, genital herpes is caused by herpes virus. Next, genital warts is also caused by virus. Syphilis is caused by bacterium. Trichomoniasis is caused by protozoa. Chlamydiasis is caused by bacteria. Okay, so bacterial are like three: gonorrhea, chlamydiasis, and trichomoniasis. So bacterial diseases are gonorrhea, syphilis, and chlamydiasis. So these three are bacterial. Protozoan is trichomoniasis. So this is a protozoan. Rest are viral. Hepatitis B and AIDS are transmitted. Hepatitis B and AIDS are also transmitted through sharing of the infected needles. Surgical instruments with the infected person, except for hepatitis B, genital herpes, and HIV. Other diseases are completely curable if treated early. Most vulnerable age is 15 to 24 years. Symptoms: primary symptoms are itching, fluid discharge, slight pain, swelling. Secondary are PIDs, which is pelvic inflammatory diseases, abortion, stillbirth, ectopic pregnancy, infertility, cancer of the reproductive tract. Next, precaution: avoid sex with unknown partner, avoid use of always use condom during the coitus, early detection and diagnosis from the qualified doctor. Next, infertility, inability to conceive or produce children even after 2 years of the unprotected sexual cohabitation is infertility. Inability to conceive after 2 years of unprotected sexual cohabitation. Next, reason for infertility are could be physical, congenital disease, drug, immunological, psychological. This could be reasons. Often female is blamed for couple being childless, but more often problem lies in the male partner. Next, infertility treated by arts assisted reproductive techniques, and this and the methods of art could be in vitro fertilization or in vivo fertilization. In vitro fertilization occurs outside the female body. In vivo means fertilization occurs inside the female body. So IVF, which is in vitro fertilization, it examples are ZIFT, IUT, ICSI, zygote intrafallopian transfer, intrauterine transfer, and intracytoplasmic sperm injections. And in vivo fertilization are gamete intrafallopian transfer and artificial insemination. So starting with in vitro fertilization, it includes ICSI, ICSI is intracytoplasmic sperm injection. So, specialized procedure to form embryo in laboratory, in which sperm is directly injected into the ovum. And the technique for embryo transfer test tube baby program includes ZIFT and IUT. ZIFT is zygote intrafallopian transfer, and IUT is intrauterine transfer. So ZIFT, it includes zygote or early embryo up to 8 blastomeres is transferred into the fallopian tube, and IUT, which is intrauterine transfer, it includes zygote embryo which is more with more than 8 blastomeres is transferred into the uterus. Next, in vivo fertilization, it includes GIFT and AI. GIFT is gamete intrafallopian transfer of ovum from the donor into the fallopian tube of another female who cannot produce one but can provide or produce suitable environment for fertilization. AI, which is artificial insemination, semen is collected from husband or the healthy donor and introduced into the vagina or uterus of the female. Intrauterine insemination. Infertility can either be due to the low sperm counts or inability to inseminate the female. Next, NCRT summary: inability to conceive or produce children even after 2 years of the unprotected sexual cohabitation is called infertility. Thanks for watching.